So we have everybody in here now. And only thing that I did was I asked everyone where they were from and have they graduated or where everybody is, And so if you want to scroll up and down, there's a lot of people that have just graduated. Some people have graduated for a little bit and they're getting ready to study now. And actually somebody said that they're already using your help already. Someone in the chat.
I saw that. Angela, yes. It's one of my people. So yes, thank y'all for joining us.
So what we'll do is we're going to first jump into introductions. So for anyone who doesn't know me, my name is Kimberly Ellis. I'm a family nurse practitioner out here in Texas. I go by my online persona is the Diabetes NP. That's my thing. I do other things, but that is the thing that I gravitate towards. We all got things we like and we love, and I love the study of it. Maybe yours may be respiratory, maybe it may be women's health. I'm the weird person that likes diabetes. So I have a YouTube channel, Kim E, the Diabetes MP, and also have, I'm on Instagram heavily and stuff. And so one of the things that I have been wanting to do here recently is just provide resources for other people, because I don't know everything. No one person knows everything, but when we come together, we know a lot. Okay. And so it's graduation time it's boards time. And I came across Brittany. I think we've been following each other for a little bit now, actually. And I am just excited about what you do. I was telling them that when I graduated in 2012, there really weren't many options. You had Fitzgerald, you had APEA with Amelie, and then there was a Blitz course with Barkley, which was not good for me. It was too fast because when it said Blitz, it was Blitz. That was like overwhelming. Like they packed everything like in a day, and it was like yeah. So I'm so excited that there is a new generation of nurse practitioners that are coming up and going to take the torch and lead us on. So I want to give you the opportunity to introduce yourself, okay?
Okay. Well, hello, everyone. I'm Dr. Brittany Winestock, founder, CEO of Nursing Studio. And what does that really mean? Just like she said, I was this person that we didn't have these options. And I promised myself once I passed boards that I was going to provide the things that I wish that I had when I was going through. So with the Nursing Studio, same YouTube, Instagram, Facebook. I really started heavily on Facebook in a group just because I was dealing with a lot of people who were unsuccessful on boards. So I wanted to give them that place of security. But now I have, branched out to offer it across the board for everybody. And just to kind of give you that foundation to prepare, because there's a lot that we learn while we're in school. And then we graduate and it's like, what do we do now, And same as you. When I graduated, there were, just a few that you commonly hear about. And they do great things, but there's things that as a new graduate you wish you had. And so I try to provide all those factors in one for people. I've done my research and other things because I have test anxiety, do well in school, never been a great tester. But I'm always the girl that comes up with a song, dance, mnemonic, or whatever else to help you through. And so I just started trying to utilize that to help other people be successful on boards and just provide you with some assistance on this journey. Each one teach one, right?
Yes. And if I can impart anything on you guys, like as soon as you get into it, you always need to go back and help the people that are behind you, the step that's behind you, whatever that may be. So I've kind of broken down kind of how we're going to do this. We're going to kind of hit it with some sections. So first off, and we're going to have Q&A as well, if any of you all have any specific issues. So we're going to do that kind of close to the end, and I'm not going to keep you all on long. So first, Brittany, can you walk us through how to approach the test? What are we up against? The differences in the two tests? I get that question all the time. Like, which one should I take?
Mm-hmm.
which one, so
Exactly.
can you bring us to the test? What are we looking at before us?
Absolutely. And I get that same question. And again, as I was facing this, like, which is which, we are used to taking the NCLEX and just going in and, having
Yeah.
one exam and not having to uh, decipher between one or another. But the ANCC versus the AAMP, I tell people to really focus in on how your study style is, your learning style. With the ANCC, people think that it's going to be more difficult because it has more factors, it has a lot of the non-clinical components. And I said, honestly, it's not that one is easier than the other, but what fits best for you. Both of them, you are credentialed the same throughout. A lot of people have gotten the idea that the ANCC is better, but the only thing is the ANCC was out first. So a lot of organizations are more familiar with the ANCC, and so that's why they commonly gravitate towards that in some spectrums. But they're the same. You are credentialed equally from either board that you take. So don't sit there and make a decision based upon thinking one is, more highly, looked at versus the other. So that's not one of those things. But when you sit down and look at what the test truly offers, they have changed in 2019 of May, like 22nd or so, they changed the exam. So the ANCC, that's the one that has now 175 questions. You have 3.5 hours to take the exam, whereas the AAMP has 150 questions and you have 3 hours to take this exam. Now on the ANCC, they have non-clinical and clinical questions, but this exam is predominantly non-clinical. And I mean, like 65 and greater percent
Wow.
of the exam, yes, is non-clinical. And so
Mm.
some people ask, what does non-clinical mean? That's your culture, your research topics, your ethics, your Medicaid versus Medicare, your billing options and things of that nature. So they do highly look towards those questions, I should say. But I want you to understand that they do put clinical content in there. So although it may be non-clinical in the question format, it's still clinical, so to speak. And to elaborate on that, like, for example, they may say, it's an Asian 45-year-old lady that comes in, and then it starts to go into hypertension, diabetes, or whatever else they may have going on. So you're still having to do the clinical aspect, but it also wants you to think and identify on the cultural aspects of how Asian populations may like to treat and, manage their care. And so they kind of merge the two. So it can go both ways. So that's how the ANCC is. But I also say, I am a visual learner, so I said the ANCC worked well for me because they offer multiple testing styles. So you're going to get the multiple choice questions, you're going to get the drag and drop questions, you're going to get those hot spot questions, which are like click here on the image, etc. And you're going to get select the best two or select the best three. So I feel like those who learn better, who are visual learners and things of that nature, this may be a better exam for you just because it gives you a variety on your testing style. So you're able to look at the image and click on those if you're visual, and then select the best two and select the best three. When we come from the NCLEX, we get so overwhelmed with the select all that apply. But I think this is a little bit better because, when we have NCLEX, it's like select all that apply. You don't know if I need to select one or all four or none of these. But with select the best two or three, it's specifically telling you exactly how many answer choices you need to select. So I think that's a huge help. And I've seen, like, when I work on that with my review students, that they find that very helpful. Whereas with the AANP, it's strictly all multiple choice questions. People have the idea that on the AANP that there are no non-clinical questions. There are some. Again, as I mentioned earlier, that they may be incorporated with some of the other question styles. So you don't realize that it's truly a non-clinical question, but it is looking at that non-clinical content. But overall, it's all multiple choice questions for that exam. So just pick what works best for your learning style so that you're able to apply the knowledge you have for those test questions.
So when I took the test back in
Mhm.
2012, I
Mhm.
remember sitting through, I want to say, Barkley told me this, Barkley Associates and Amelie,
Mhm.
when they were going over the different tests at that time, they were telling us that AAMP was all clinical. No,
Mhm.
none, it was like all clinical.
Yeah.
And ANCC was, there had theory and there was research, and the
Mhm.
type of theory that they had on the test was not what we went through school for. And that
Right.
freaked me out because I was
Right.
like, okay,
Exactly.
the things that they have given me, I can study that. But if you start pulling
Right.
in some other stuff,
That
then
I
I
have
don't
no.
know,
Mhm.
and so that's what was the deciding factor for me was AAMP. Plus, there were less questions. Plus, at the time, it was a cheaper test, and I was tight on
Right.
money. And
Uh-huh.
so I was like, let's go.
Right.
AAMP, you're the one for me.
Exactly.
So just curious, which
Exactly.
one did you take and how did you choose?
So, okay, so for those of you who don't know me, in my background, I wasn't successful on my first attempt. So I've taken both exams. So that's
Mm,
why I can tell people, look, this is how this one is, and this is
okay.
how this one is. And the thing that was the game changer for me, because I was the same way with the ANCC, was that it wasn't what we learned in school. So you
Mhm.
had to learn what they were truly testing you on. And so I was able to identify that and be able to be successful. But I am ANCC certified. So that was the boards that I went through. Because I was the same way with you. I went with AAMP first because I'm like, oh, I don't want to do that or whatever. But being a visual learner, I felt so much better on the ANCC because it wasn't like I was just strictly answering multiple choice questions because I can get tired of, just reading scenarios and answer the questions. So it gave me a variety. I was able to click images like, okay, you know, I can tell you that's psoriasis. Let me click here. Okay, where on the chest x-ray should I click for somebody with, TB or whatever? Let me click here. And so that helped me for my learning style. So I
Okay.
just tell people to think of those things. But yeah, so I passed with the ANCC.
Yes. Um,
Mhm.
and just curious, because I
Uh-huh.
always like to hear these things too. For me, the NP boards was, to me, it was easier than NCLEX. Like
Uh-huh.
going through
Uh-huh.
NCLEX, I don't know if it was because I had to do the HESI and they had like, it was all that stuff and there was this anxiety around the NCLEX. Though I did pass and I passed with 75 questions, I felt like as I was taking the test that I was like really having to key in. But when I took the NP boards, like there was a time there where I was like, I must be doing really, really good, or I must be doing really, really bad, because I was expecting NCLEX level of, not to say that the test is, that like you clearly have to study, you clearly have to study, you clearly have to go through a course, go through your curriculum. But I felt like I came out of school prepared, and when I studied, it was okay, making sure, okay, I'm keying into
Exactly.
what they're trying to get me to know, murmurs and
Exactly.
things like that. But once I got
Exactly.
that down, I went into that test like, yeah, I can do this. I can do
Exactly. Exactly.
this.
I
So
agree completely.
here's another one. Okay. So now preparing, let's get into the exam. Okay. So everybody, you got different learners, and you know
Mhm.
this more, you've taught people, and you have people
Mhm.
that come to you that have different learning styles.
Right.
So how do you get people to really prepare so we can all be successful? What are some good tips, tricks, and trades that we can do?
So for all of my learners, I'm like, initially start with a study schedule.
Mm,
You need to do a strict study schedule because look, I get it. I was there. I was that person. We've been through school. We've done everything that we could possibly do. And now listen, we graduated, we're tired, we're burnt out.
yeah.
We're trying to work a little bit more because we couldn't, maybe you've adjusted your work hours or whatever the case may be. Spend a little bit more time with family because you were so consumed with MP school that now you just want to take a break and then study and then just knock this test out. But I want you to create a study schedule. And what does that mean? Sit here and map out the time that you really need. don't rush through it. And you need to think about realistically your lifestyle. So for me, and you may hear them, y'all, forgive me, I have 3 small girls, married, 3 kids. So with this, we have to adapt around the lifestyle of being mother, wife, soon to be NP, working, etc. And so around that, don't just sit here and say, okay, I can study for 8 hours today, knowing that you need to take your daughter to dance lessons, or, you've worked the day or whatever else. Be realistic, because then you're going to become overwhelmed because you haven't met your goal, and you're going to, feel that as though you're behind. So what I would do on the days that I worked, or whatever my busier days, I would set my schedule a little bit lighter around those days that, were easier on me, or I was off. Those were the days that I spent so much time, more time. And people ask me when they're doing their study schedule, do I really need to study all day? I think that's overkill. Some people it works for, but honestly, you need to allow yourself time to retain the content, okay? So you want to make sure that you have enough time to review it, read it, write it, retain it. And also when you're doing your practice questions, to allow yourself enough time to go over those questions and review the rationales. So, we can be overzealous and think, oh, okay, I'm gonna do this, I'm gonna study all day, I'm gonna cover this section, this section, and this section. I'm gonna do 150 questions each day. Then it's like you're burnt out and you haven't retained anything. So what have you gained from that? So be realistic with your lifestyle and your schedule, and set it out and make it plain. Write it down, schedule it all out, and then go from there. And follow your schedule strictly. And when I say follow a schedule, I mean, so say tomorrow on Wednesday, I'm covering cardiology. So when I say I'm going to cover the first half of cardiology, that means I was a person that got up early in the morning because my kids were still asleep, my husband was asleep, nobody needed me at that time. So I would study at those hours because I knew I could really focus in, and, without any distractions, and before life happens, to be honest with you. And so I always say, if you're going to study in the morning, set your stuff out the night before. So it's not like, okay, I'm going to study from 5 to 6. But now between 5 to 6, you're finding your book, you're turning the page, you've gotten distracted because as you flip through the book, you looked over something else and you're like, oh yeah, I need to study that. No, have your stuff wherever you sit and study on cardiology for that day. So when you come in the morning to study, you can go straight to it and spend that whole hour or whatever time you have allotted towards studying. So that's a big thing, number one, that I say do for your study topics, when you're planning to cover it. Next, I say break them down by systems. So break it down. If you're going to say that I'm going to study, just going to flip through and study whatever, you're never going to really truly know what you're covering consistently. So go by system. Make sure that you're getting through the practice questions correctly with that system, making sure you completely answer that, understand that system and able to retain it, and then move forward with the next system. And then lastly, with practice questions, I get this question a lot, like how many should you do? People think you should do, the test gives you 150, the test gives you 175. Should I do that much each day? I say no. I say gradually increase to that as you're studying. So if you do cardiology, and y'all, I'm a cardiac NP. I'm a family nurse practitioner, but I work in cardiology. So I always go to cardiology, that's why. But say we're studying cardiology today. So you cover all of those, the system, and now you want to do practice questions. Do 10 to 15, 20 to 25 of those questions, today, and review that so you're not burnt out, because I want you to review the rationales. That is a huge part of retaining the content, because those questions that we get incorrectly, you need to go back and review the rationales. And I always say, keep a notebook. I had a plain notebook specifically for those questions, the rationales. I would write down the rationales that I got incorrect. And so at night, when I was going to bed, right before bed, I would review the stuff that I had gotten wrong. So, it was just another refresher for me. So that's just an additional study tactic that you can use for your practice questions. But I do say build upon it, because as you are going through your study calendar and say, Monday, Tuesday, Wednesday, I'm going to do cardiology, I'm going to do the practice questions. when you get to that last week of questions, you should be able to answer the amount of questions that you're going to sit for boards on, because you want to make sure you're trained and conditioned and you're able to sit down and truly answer that amount of questions in one sitting, and do well on that and see where you are from that standpoint. I know that was a long spiel, but
Oh no, oh no. Something that also, and I'm just like I have not taught anybody. I'm just going to tell y'all what worked for me.
uh-huh.
I
Yeah.
did do what you said, and I made a very strict study,
Mhm.
schedule. And something
Mhm.
that I did was I started with my hardest subjects because I
Exactly.
was very refreshed, because it's
Mhm.
very easy to be like, well, you know what, I can whiz right through this. One of my easiest subjects is respiratory. I mean, it is in ENT and all that stuff.
Mhm.
They've always been easy for me to whiz through. And
Mhm.
so it was easy for me to be like, well, let me just knock out respiratory. No,
Right.
actually, what was more of my challenging subjects were cardiology and
Mhm.
endocrine. And so I
Mhm.
started with them at the top of the week. So I could be
Exactly.
like, my brain is fresh. I'm the most motivated. And
Mhm.
so when I'm tired and I start to get mentally tired, well, then you already know respiratory really well, Kim,
Exactly.
so you don't need to be as fresh for that.
Exactly.
And that really helps me
Exactly.
to retain a lot
Mhm.
more there. And I also like made a lot of, for me, I'm visual and I'm tactile.
Mhm.
So
Mhm.
when I write stuff down, not only do I see it, but I have memory, muscle
Exactly.
memory. So
Exactly.
like literally when I'm taking tests, I can remember where I saw an answer on a page.
Mhm.
And
Mhm.
so that's why I do flashcards, and I would give them to my
Exactly.
husband and he could quiz me.
Exactly.
And I would try to teach him, because it's like, if you can teach it to somebody, then you really know
Absolutely.
it. You know
Mhm.
what I'm
Mhm.
saying? And so,
Exactly.
yeah, those are the things that worked for me. I don't know if y'all are doing that, but those are things that helped me.
And I agree. And it's funny that you say that, because I teach that in like my courses. When I tell people, I say start with your weaknesses. When you build your study schedule, start with your weaknesses, because the average person wants to start with what they're strong in, because it makes you feel good. Like, oh yeah, I got this, I did this, I scored this. And it's like, but
Yeah.
that's not helping you. Start from the
Yeah.
areas that you're weaker on. So as you said, you're fully energized, you're more focused. You need to spend that energy and time on the stuff that you need more time on, because you're weaker in those areas. And then as you get winded, tired, or whatever else in your stronger areas, you don't need as much time on. So yes, that's one
Hmm.
of my things that I always say: start with your weaknesses and finish out with your strengths. And if
So
you don't
let's
know
go.
those, write
Let's
those
move.
things down.
Oh, I'm sorry. I didn't mean to interrupt you. What were you saying?
I was just saying, I always say make a list of your strengths and weaknesses, so when you make that study schedule, you're aware, and go through them. But
Okay.
that's
Now let's move into study tools, because there's
mhm.
lots of different things out there. We mentioned
Yes.
many different courses and stuff like that. And now there's just a lot. And now everything is online now. We're in a pandemic.
Right.
So
Exactly.
everything's online. So what are some
Exactly.
good tools or things that maybe that would be good for visual learners, maybe, different types of people,
Right.
and even more specific things?
Right. And so y'all know the common things that are out there. We got the Barkley, the Leaks, the Fitzgerald, the APA with Collier and all that. My review courses, whatever. You have all of those things, but you got to figure out what fits best for you. And most of them kind of do, the audio that you can listen to either CD or MP3, MP4s, and I say go with your learning style with those. Pick what works best for you. I tell my reviewers all the time, listen, you don't need every review course,
Mm,
because you're going to become overwhelmed.
yes.
Pick the review course that fits your learning style and stick with it. That's the simple thing of it.
Mhm.
Fitzgerald is packed with information. So I always say, if you're like someone who needs to read and see it, she is the review course to go with.
Mhm.
Collier and Barkley have similar teaching styles, so they have all the audio, as well as the booklets, and they're funny. They give you fun and different ways to retain their information. So I think that's very great, so that you're able to listen to it, if you're driving to work or whatever else, as well as reading it, etc. And Leak, I stress that Leak is amazing for preparing for boards. And I always say this to people because Leak takes the exam. Every time it's time to recertify, she takes each exam. She doesn't just go and recertify, right? So she is very familiar with how the test changes, what is seen, whatever else. So her questions are closest to board. So I always say, if you don't do anything else, get her book and do the practice questions or whatever. So you are familiar with how the test questions are, to go from there. And there's a variety of test taking apps out here that you can practice with that are very helpful. And then, like with my review course, I provide all those things just because, again, I was trying to create something that I felt that I was lacking when I was going through. So you'll get your video, you get your audio, you get your written parts. So it says, is Leak most aligned with the ANCC or AANP or both? It's with both. She certifies with both exams. So she is very well versed in all of those. So I always say her testing questions are great for each. How do we figure out what type of theory things to study for ANCC? So for the theories, they cover research. You need to make sure you are very familiar with the research hierarchy of need. The pyramid. I want to make sure y'all can still hear me. The pyramid for research hierarchy of need, making sure you know the cultural concepts. So looking over those cultural, being able to understand cultural competence, and those different terminologies. Be very familiar with the terms, relative risk and those things, as well as understanding, the Asian, Buddhist, all the different cultural practices that can help you. But again, I can't stress more to you enough for being able to identify the research hierarchy of need, the pyramid, for that factor. It says, how would you break down the pulmonary systems? I'm very weak. I'm not in the topic, so I started with that first. Okay, so with the pulmonary system, I'm big on saying, if you see things with ranges, make charts. Let me show you. So this is my second edition review book. I just want to show you a picture because I'm big on making charts for these things. So the big things in pulmonary is asthma stepwise approach in your COPD, those guidelines. So just put them in ranges and group them together so that you're able to study, because it's strictly a range. It's going from level 1, 2, 3, or 4 basically. So level 1 is going to be okay, level 4 is going to be worse, and just knowing how to do it. So I just want to kind of show you so you can try to make your own. So see, just making charts. I know you can't really see the words, but kind of getting an idea of that, of breaking it down. And one thing that I always like to tell people, when you break your stuff down, any system that you're covering, the test wants to know that you're able to do an assessment, diagnosis, evaluation, and treatment. When you get your scores back, if they break anything down, if you're unsuccessful, those are the areas that are going to break those things down in. So what does that really mean? So think about, let's do pneumonia. So with pneumonia, your assessment, you need to identify those signs and symptoms. Do they have, rust-colored sputum, a cough, whatever? Did it happen gradually? Was it, suddenly, or whatever else? So diagnosis, what is the gold standard? Always know your gold standard. What is the gold standard for pneumonia? Chest x-ray, right? So you do chest x-ray, you see the opacities on there, so you know that is your diagnostic for pneumonia. Evaluation, curve 65 can be something for evaluation, and that's just your confusion, your urea being your BUN, your respiratory rate, and your blood pressure. And then those people 65 years of age and older, if they fall into those categories with 2 or more of those, then they need to be treated in the hospital. Whereas if it's less than that, you can treat them outpatient for those conditions. And then treatment, how do you treat? Are you going to give them a macrolide? Are you going to do doxycycline? Whatever the example is. So as you go through each system, make sure that you're able to answer those questions as far as assessment, diagnostic, evaluation, and treatment. Okay, let's see. Is there any way to remember the treatment by asthma? Do you said do you suggest we read a section or review book like Leak and then do an amount of questions, or how do you break down your study? Okay, so asthma, that just kind of went into what I was just giving you the rundown on. But yes, so my breakdown when you're making a study schedule is, hey, sit down and see. I always tell my people, you read it, you write it, you listen to it, to make sure you're retaining it. That covers all factors. So if you're reading in the book, you read it, you get that content. Okay, so say I read cardiology for today. Now I'm headed to work. I'm going to listen to it on my way to work. Or, hey, I'm cleaning my house, doing dishes downstairs, whatever. I'm going to listen to it at that time. And then write it down later. As you're studying, write down those notes. These are all tactics to make you retain the content. So those are big things that I say. So yes, I say always, whatever review source you choose to use, read that content first, write it down as you're studying, listen to it, and then do practice questions. You don't have to do practice questions every day, but I say as you do it in small chunks, it makes it less overwhelming, and you're able to review those rationales and move forward. So if the typical study schedules, like when I make study schedules for people, what I do is say, if we're covering cardiology over a 3-day span, today we may cover hypertension, cholesterol, and those are your areas of focus. So then as you read over those, I want you to read them, spend time reading it, making sure you understand it. Write down your notes from what you get from that. Listen to it later, but then do 10 to 15 questions on that as well. So that's how I kind of break it down. But you also know the time frame you have allotted for your review. Let's see. Do you recommend studying before taking a review course? Yes, definitely. Even if you come out of school feeling like you're very strong, and you may have done well in school, make sure you study. If you've been studying and preparing for boards, even when in school, you may need less time to prepare, but make sure that you're utilizing and allowing time to study and prepare for boards. Because just like if you think about the NCLEX, things we did in school and the way we prepared in school, the testing style is totally different. So you want to make sure that you're able to retain that knowledge and apply it appropriately to the exam, okay?
Yeah.
Someone wants to show the chart again. Okay, I will. How much cardiology will be on the test? Do you need to know specific dosages for ANCC? Okay, I'll show the chart again, as well as cardiology. It's not specific as into range. I always stress to everybody, utilize your resources. The ANCC as well as the AAMP gives you blueprints. So if you're FNP, AGMP, PNP, whatever your specialty is, they give you the blueprint broken down to the percentages of what's going to be each area, as well as practice questions in those areas as well, so that you can know what to expect and kind of get an idea of how they test on the exams. Okay, so cardiology is not specifically broken down into a percentage on the exam, but just know that they do incorporate, like hypertension. I always say, people always ask me like what to expect. The common things, the common illnesses is what you're going to get on the exam, because they want to make sure that you're able to be at the the minimal competency level. So hypertension, that's common. Diabetes, that's common. Asthma, that's common. COPD, that's common. You're going to be questioned on some of those. So I tell everybody, when you go through those systems, if you look through and you're like, this is something common that I see as a nurse or anything in practice, they're going to ask you about that.
Yeah.
Okay, somebody was asking me to re-show the chart. So in the chart, I just kind of break things down based off of what the range is, the symptoms, and the treatment, okay? So I just say break your stuff down so that you're able to look at it and it's not so overwhelming, okay? Let's see what's next. The day before your test, and any tips for managing test anxiety while testing. So yes, Jeanette. So the day before the test, you should not be studying like bulk information. I
Yeah.
always say, like, if you do like a little notebook, like with your rationales or whatever you're writing down, little common things you jot down. If you hear of a scratch sheet, you can make your scratch sheet, because you know when you go on to exams, they give you those boards to write on. So those boards that you're writing on, practice that. So when you get in there, before you even start the exam or any tutorials, you can write down the things that you commonly, kept in your mind or jotted down that you want to review. So the day before, I say, just review those little quick tips and areas that you have, that you've been reviewing throughout your however many weeks, and you felt like these are little areas that you just need to refresh on. Always keep a little notebook, so then it's like you can quickly flip through that the night before. It shouldn't be like a heavy study area. Test anxiety, girl, I got it. So
I do
listen,
too.
right. So I
Mhm.
always say over prepare. When you over prepare, even when anxiety kicks in, then it's like you got a backup plan, basically. You know what I'm saying? So if you go in here studying just, the minimum, when anxiety kicks in, you don't have too much to kind of back you up. But when you over prepare, and that's why it's so important to focus on those weak areas that you have, because when you over prepare for those, it's like, okay, even if I get flustered or whatever else, I still have enough in me, because I have focused so much in on that I know it like the back of my hand, that I can even function when I'm anxious.
Mhm.
And that was like the game changer for me. So say, um, if the asthma stepwise approach is like my weakness and I struggle with it and I just can't get it down or whatever else. Okay, well, daily, I'm going to put it in. And so what I would do is, I say, make flashcard sheets. I would hang these things on the areas in my house that I go to frequently. So it will be like a flashcard, but it's a full sheet. So say asthma stepwise approach, COPD guidelines, whatever your thing is, and have the answers on the back. But I would have the questions in the front. It would be on my bathroom door, my closet door, my refrigerator. So every time I went to the fridge, every time I went to the bathroom, it's like, okay, they having 2 symptoms, a week or whatever else, and it's making me answer these questions. If you get stuck, flip it over, look at the back. But it just made me incorporate that into my daily schedule, because you're doing it outside of saying, oh, I read my book today. Oh, I already did my practice questions. No, it's giving you an additional factor to go in and give you a review in your busy schedule, because we're all busy. So we all got to go to the bathroom. When you go to that bathroom, review it each time. You know what your weakness is. You know the areas that you steer clear of, because you don't want to do it because it's your hardest area. So you want to spend the most time on those, because if you get anxious, guess what? When that question pops up, that's when anxiety is going to kick in, because that's your weakness. So I say over prepare, so that when you get to that point, you can beat anxiety. Okay. If you need to take a moment and, breathe, whatever, refocus, do that. And I also say, side note, in my rant, in my soapbox, if you are not 100% sure that the question is incorrect, do not change it. Because they have so many features on the exam. You can mark your questions, you can go back and look at it now, etc. Marking and doing all that makes you go back and change things or whatever else.
Overanalyze.
Once you have selected that answer, stand on it, unless you have read back through it and like, okay, no, wait, I made a true mistake here. That's the only time you should change it, because too many people they lose points from just switching answers and you were correct the first time.
Hmm.
Um, I would sincerely like to know what review books would help me learn and prepare for boards. Any specific app that would be recommended for question that breaks it down by system. I have the link intense review book, but the questions aren't grouped by systems. Okay, so Hawyer is very good on having questions by systems, and if you get those incorrect, she gives you it gives you a full like group system breakdown and letting you know where your weak areas are, etc. So those are good apps. But still, even if you're not doing it by system, just doing questions daily in a small portion will help you as well as you review systemically. Now, I do have questions by system in my book, but again, I'm just trying to tell people, because I know we spend money on so many things, that I want you to know what is beneficial on stuff that you've already purchased or whatever. So Leak is great. So even if it's not system specific, do them if you got her book. If you have any of the other resources, utilize what you have and just break it down. If you need to write it down in systems or whatever else, do what you got to do to make it work for you. I just want you to do practice questions so that you are testing your knowledge that you have reviewed and applying it to a question format, but making sure that you review by system, because reviewing by system is ensuring that you are covering all the content by that system before you move to the next. Because when you're just kind of just, oh, I'm using Leak, I'm using Fitzgerald, I'm using whatever, and you're flipping from multiple resources, sometimes it's very common that you skip over things that you need to review because you got too many things, and you cover musculoskeletal, you cover cardiac, pulmonary, whatever came to pass when you were flipping through that day. So that's the only reason why I tell you to focus on systems. Kaplan is broken down the system as in Fitzgerald. Okay, if you use the Leak app, you can take the questions. Yep, Leak app is good. Book shown available for purchase. Said Nicema, are you asking about the book that I'm talking? I showed my book. Yes, it's on Amazon. This is my second edition. My first and second edition are on there on Amazon. If you just search my name, Brittany Winestock, Winestock spelled just like it sounds, wine and stock, you'll be able to see it. My second edition I actually have on there on sale for you guys for $39.99 if you want to purchase it as well. But yes, it is on there for you. And for those who are questioning, I know, like, sidebar, that might not be what you're asking, but just to kind of tell you so you know what you're purchasing, because I like to know what I buy. So with my book, what I do, listen, if you have stuff that you need to focus in on, then get those resources. I am a no fluff type of girl, so I break everything down. All of my systems are broken down, like I tell you, like assessment, diagnosis, evaluation, and treatment, because that's what they test on. So you can see all of my stuff is pretty short and sweet. But what I do per system, let me try to get you to a page so you can see it. As you go through the system, you're going to first get the content, because I want you to read it and I want you to retain it. Then I'm going to give you an interactive section. So you see where there are blanks and lines. It's truly a workbook so that you can actually write and fill in the blank and make sure that you are understanding this stuff and content that you have just previously read. I have the medication list associated with that system as well. And then I have practice questions associated with the system. So that's how it's broken down per system, just because for my teaching format, I know you need to read, you need to write it, you need to listen to it, you need to test your knowledge. And so then I have audio if you follow my courses, so whatever the case may be. So that's how that book is. I want to check and see if y'all have any more questions. So I see something says, tell you about my course. So y'all, I offer so many courses. So for people preparing for my new graduates, first let me say congratulations. So yay. Y'all know I'm real animated. So congratulations, everybody. I'm sorry for all my little errors tonight, but congratulations. I'm truly happy and proud of you guys, because this is not something light that you need to take lightly. You have really accomplished something major, and even through this pandemic, many of you are still working as nurses through this on the front lines, as well as successfully passing your NP and graduating and not getting those full the traditional standpoint. But don't let that stop you. You keep pushing. You have done it. I am super proud of you and happy for you during this time. And so now you just got to keep pushing and excel and finish the finish line. You have made it here, but don't stop. You didn't come this far to only come this far. So keep pushing. Don't be discouraged. Take the time that you need. Give yourself grace. Be patient through this, and allow yourself the time to truly study as you need to study. Pick the test that works best for you, and utilize the resource that you have. I know this is a difficult time or whatever else, but again, the things that I offer. I have a few things that I offer. So I do things, a full review course. So the course that y'all will know about that I'm offering to you guys for today is $199.99. Typically it's a $249.99. You will get 25 CE credits for this. All of my courses are accredited through the ANCC, so you will get, and it doesn't matter where you take either test, that's the organization that I am accredited through. So if you're AANP certified, ANCC, whatever, it works for either. So you will get 25 CEs through it. It is broken down by system. It's the video of me teaching and doing all of my Brittany's Brilliance. You see me dance and sing a song or whatever else to help y'all retain. I look crazy just to try to help you guys because that works best for me. We do practice questions. It's not a ton of practice questions for it, but I really just want to make sure that you're getting an idea for each system for those and what the test will kind of gear you towards and question you on and making sure you get an understanding. So on those questions that you click through, it will let you know whether you know what's correct, incorrect, etc. So that's the course that we're talking about. And again, I understand, so I try to meet all platforms because listen, I was that person in that stage. So sometimes $199.99, even though it's a sale, is not what you need and not works best for you at this time. So I have offers that go anywhere from $999.99 on up. So I do things per system. So say you're good, you have all your resources, but cardiology is your weakness. I have it just so you can just purchase the cardiology video and practice questions. You know, so each system is the same way, you know, just like that. So you can purchase it for systems. If you're just looking for CEs, I have those options as well. And then, like I told you, I have the review book. It's $39.99. So if you're not able, you know, to get the full course, you can get the content and practice questions in here as well, which is found on Amazon. So that's where my questions are. So that's the course that I see Kimberly told me to explain. And then Angela's Brittany so helpful on so many levels. Her book is super helpful. Oh, thank you, Angela. Thank y'all. One, I want to say thank you for even y'all taking the time to join us tonight. Thank you, Angela, for your feedback. Yes, I do have a Facebook group. I started out on my Facebook group, so you will see many, many videos of me on there. I have the bulk of my stuff on there just because that's where I initiated. So it's a lot of videos that you can watch per system on there. And any of the offers. I'm trying to do better on Instagram, you guys, with all of those things. And then I have my YouTube channel at the Nursing Studio that has videos as well. So we do our topics and tips Tuesday each week that you will find on there. And typically on Wednesday, we work through a question. Any other questions? Uh-oh, I see more. I'm sorry, y'all. I thought that was the end of the question. What is the name of your Facebook group? The name of my Facebook group is the Nursing Studio. Make sure y'all see the logo. I don't know if y'all can tell what that is. The Nursing Studio. The Nursing Studio, because honestly, I've seen someone that just recently created a YouTube channel with Nursing Studio, and that's not me. So I want to make sure that y'all are looking at the right thing. It's the Nursing Studio. It's yellow, pink, and blue. Has a stethoscope through the U in nursing. You usually see my face on it. But my Facebook group is the Nursing Studio NP Survival Group. The Nursing Studio NP Survival Group. Okay. Let's see. Just purchase your book. Thank you so much. You're welcome, Jenna. Sorry, I'm a real personal. Listen, y'all, I'm from South Carolina. I'm a real Southern girl, so I'm gonna like a little personal thing. Thank you, Jennifer. I saw you said you purchased the book, and thank you. I'm happy to assist. Thank you for your purchase, and I'm happy to assist you out. You guys, I see some of you requesting to join, so as soon as we finish with this, I will get you all put in there, okay?
And thank you, Angela. For me, I'm more so once
thank
you
you,
become
Kimberly.
an
Yep, that's the website. Yeah. Thank you. Thank you, Brittany and Kimberly's information is so helpful.
You can come and see
me.
But y'all are going to
thank
do
you,
it.
Sheila.
Y'all are going to be good.
I don't know if y'all can hear me when I'm reading this, so thank you, Sheila. Let's see, Latoya Murphy. May I see the front of your book? Sure. So the front is the blue one. This is my second edition. The pink one, when you look on Amazon, is my first edition. So get this one. It's the one that's the cheapest because I have a sale on it just for you guys. And the other book, Trusting My Journey, is just an entrepreneurial book for nurses. So for review purposes, just look for the blue book. And it says second edition on it. Yes. So Angela, yes, I will do, because they were requesting in June. So I just recently did like a practice question review course, just so we can just focus on doing questions, how to focus on questions. I'll give y'all that tidbit really quick, just a brief Kim, if you could do this right here, because I can't hear you.
Oh,
You can tell me I need to
we're
stop
just gonna
talking.
wrap it up. We're just gonna wrap it up.
Okay.
That's okay.
So I did a recent practice question review course. And so what that entails is just going through questions and breaking it down and talking about what that truly entails. I like to tell people first, read the stem of the question. What is the stem of the question? That's the last part of the question. And that's typically, what the question mark is. So maybe it may say, what is the nurse practitioner next best action, etc. I say read that first because they like to give us this full scenario and you're looking at it and you're like, okay, and you know how we do. We are nurses at heart, and now we have the MP knowledge. So they give us all this background, and we are sitting here diagnosing based off of all this content they give. Then you get to the question, they didn't even ask you nothing about any of that. So I say, read the stem of the question first so that you are truly answering what they are asking you, so that you're not making careless errors. And then I break down how, to eliminate those questions, those answer choices, and the different tools they have, like the highlight feature, etc., on there. So that's what she's talking about. And so, Angela, definitely, I will still offer that in June. People have requested that, so I will do it again in June for you guys. Thank you, Father. And how long is the course available once purchased? Let's see, that was Shirley. Great question, Shirley. So I do lifetime access for this because that was another factor I hated. You purchase, you spend $500-$600 on a course, and they tell you watch it 3 times, and then you can't do it anymore. Like listen, I was watching the first video and stopped because my kid was over here doing something or whatever the case may be. And when I really had time to look at it, I watched the second time. And now that I had an aha moment and watched the third time, and now I can't look anymore. And that was my frustration. So with my courses, you have lifetime access. But I do say this, I update annually because I do provide CE credits. So I want to make sure that our guidelines are up to date with what the new tests are offering, and to make it CE credible, okay? So anytime you look at my stuff, it's going to be the most up to date. So I always do say that you can look at it forever. Once you purchase it from me, it's yours. You can have it, whatever you want to do. But do know, annually, I will update it. And so there'll be the changes from that standpoint. Thank you, Kim, for posting that. The Nursing Studio MP Survival group on Facebook. Sign up for your new course. Yes. So let me say that Kim is amazing. She does a great job. I appreciate you so much for even having me. So she does amazing work. So follow her. Make sure you're taking advantage of all the stuff that she has to offer because it's great. And I have gotten so much feedback from people that work with me that said they follow her and things they have done. So don't miss out on that either.
Well, guys,
again, thank you guys for having me. And happy studying. If y'all have questions, again, it's at the Nursing Studio on all platforms, Instagram. Again, we put my Facebook group on there, the Nursing Studio MP Board Survival Group, and on YouTube, the Nursing Studio. That's where my videos are, and I'm trying to do a lot better on that. And then Amazon says you search my name. So if you have any questions, I'm really open. Those of you who know me know you can send me an inbox anytime, and I'm happy to answer your questions. So feel free to reach out to me. Thank you, Kim, again for having me. And I can't hear what you're saying, but I'll let you do your thing.
Okay. Well, all I was going to say is goodbye, everybody. Thank y'all for coming in, and just stay tuned for any future resources. I will be sending out an email that has her information in it as well as mine. And thank y'all, and good night.